Alrighty. So we're gonna do take 2 on this. My device doesn't have a lot of storage left, so we're gonna a little creative. Anyway, we have cranial components. This is one of those nerves that we were talking about last time, and those brain stems, those cranial nerves, actually really come into play. But the big ones we're focusing on are oculomotor, or nerve 3, glossopharyngeal, or nerve 9, and the vagus nerve, nerve 10. We're also focusing a little bit on the facial nerve, nerve 7. But the 4 main ones are oculomotor, 3, facial, 7, glossopharyngeal, 9, vagus, 10. So 3, 7, 9, 10. So you have the oculomotor. This controls the ciliary muscles, lens, focus, near, and pupil constriction. You just gotta kind of have to know what these nerves do. If you don't, you're kind of a little bit cooked. So the oculomotor, that's like a big thing it does. Facial nerve controls the lacrimal glands and small glands of nose and nostril, controls subdermally and sublingual salivary glands. Again, I hate to say you just gotta kind of know what these do. You just kind of have to know. Control parotoid salivary glands. The vagus is the big one. If you don't know what it does, you're cooked. But the vagus is a variety of functioning, including slow heart rate, constricting lung bronchi, increasing digestive secretions, and strong carbohydrates. I believe this is the only nerve to kind of leave this upper part of your body and go to a lower portion. That's a sort of small little note you might want to take down. And then you have the pelvic splenic nerves, because like I said, the vagus one is really the only one to actually leave. And these affect smooth muscle, constrictive, increased secretion in the urine and digestive systems. And this just makes sense because pelvic, you know what your pelvic is. Urinary, smooth muscle is down there. It's just all kind of down there. You should be able to take a good educated guess on that one. You got the sympathetic division. Again, exercise, fight or flight. I cannot hammer this into you more. Non-epinephrine. It is the more post-ganglion, multiple branches. I don't know what more I can say. Again, we're back to the lateral horns because it's the thoracic lumbar columnar. I think I said that backwards. But you get the point I'm trying to make. T1 to L2. That's where they are found. Myelinated axons course through the anterior roof of T1 to L2 spinal nerves, then branch off. That goes back to the lecture, like the part 1 of this entire thing. Don't worry about it. Because I don't fully understand it either way, you know that. But yeah, it's there for you to know. Use your brain. Next, you have organization and anatomy of the sympathetic division. Sympathetic. We're back at it again. Sympathetic chunks and ganglion. Left and right chunks just lateral to the vertebral column. Trunks resemble a pearl necklace. I don't really know what to add to that. It's exactly what it says. Left and right trunks lateral to the vertebral column. I don't know what to add. I don't know what you want me to add there. And then when you gotta just look at the picture, like the challenge is to not show you guys pictures. You just gotta look at one. And then you have the trunk resembles a pearl necklace. So when we were going through, like Telvico was showing us those little dots, that's what that was. Strings are composed of axons. The pearls are the sympathetic trunk ganglion housing subbodies. So this is just kind of, I don't know how to describe it. I know what I'm thinking, but I don't know how to put it into words. White and gray rami connect spinal nerves to the sympathetic trunk. White rami communicates, myelinated. Again, we go back to the first thing. The first thing we learned, white and gray matter. Which one's myelinated? White matter. White rami is myelinated. The entrance ramps to the trunk. Gray matter is unmyelinated, and I can't read that last little bit. Hopefully it's not important. Let's see here. it exits. So going back to my mnemonic for that one is white, like, is rushing in to protect people. Meanwhile, gray is like morally gray. They're leaving. They don't necessarily feel the need to protect people. Sympathetic division. Preganglion neurons are in the spinal cord, T1 to L5. We've been through this multiple times now. Preganglion fibers pass through white rami, communicates, and enter sympathetic trunk ganglion. So the white rami, you're going up. That makes sense. Ascending. Sympathetic trunk ganglion, it leads through. Goes to all those. Axons exit the sympathetic trunk by one of 4 pathways: spinal, postganglionic sympathetic, splanchnic nerve, adrenal medulla. Okay, so there's a little note down here that says review. Do not need to know the details of the first 3 pathways. Do know the pathway 4. So we're gonna speed run through these because we don't even know them that well. So the spinal nerve is skin effectors of neck, torso, and limbs. It's preganglionic, entosympathetic trunk, ganglion, and synapses with ganglionic neuron. Postganglionic axon travels through gray ramus at the same spinal level of the ganglion, joins the level spinal nerve, and extends to effector. Just read that slide. That's all I did. I have nothing more to add. It says what I need. Just reviewing. Yeah. The postganglion sympathetic nerve, the effectors that are internal organs of the thoracic and neck. So last one was neck, torso, and limbs. This one is internal organs of the thoracic and neck. Pre-ganglion neurons enter in synapses in the trunk. Post-ganglion axons goes directly from the trunk to ganglion to effector. Does not leave the trunk via gray ramus. I think it's just because of the image. She has that little note. Splanchnic nerve. This one, the big thing is abdominal and pelvic viscera. It's preganglion axons pass sympathetic without synapsing. Axons travel in splanchnic nerves to prevertebrate ganglion, where they make synapses. Postganglion axons innervate effectors. And then she has a big note. Prevertebrate ganglion located anterior to vertebral column. Most of them, as we recall, were lateral to the vertebral. This one's anterior. Keep that little note. But I just went through those. I would recommend reading them again, just a bit slower. There's not much to add. You don't really gotta know them. So yeah. Okay, this is the big bad boy pathway that we're gonna go through slowly. You have the adrenal medulla pathway. For central regions of adrenal gland, it's medulla. It's in the name. Adrenal medulla. For central regions, adrenal gland, it's medulla. This all makes sense. The preganglion symptoms of axons extend through sympathetic trunk. And prevertebrate ganglion without synapsing in either. So they haven't touched yet. Preganglion cells stimulate adrenal medulla cells to release epinephrine and non-epinephrine. Again, what are adrenal stuff? It's our epinephrine and non-epinephrine. Adrenaline into the blood. And adrenaline is our flight or fight. The only thing that I really would recommend you have to figure out a little bit more is the preganglion sympathetic axons extend through the sympathetic trunk, which if we go back up, we know the sympathetic trunk is left and right of the vertebral column, lateral, and it represents the pose. So it's stuff right next to it. And extend through the sympathetic trunk and prevent prevertebrate ganglion. And then just keep in mind, just so you know, stuff affected by the sympathetic: cardiovascular, heart increases, digestive system, more viscous saliva is produced, GI tract decreases motility, pancreas, liver. With the liver, you get more glycogen. Respiratory, dilation to increase airflow, urinary retention of urine, kidney release of urine helps increase blood pressure, reproductive system, it's ejaculation. This one, uterus and vagina, contraction of walls during, erectile pili, contraction, sweat glands, release of sweat, blood vessels, vasoconstriction, iris dilation, other structures, release of epinephrine from adrenal medulla, iliopsis, and adipose. So that one is just like a big, you just gotta read it slide. You should kind of have an idea of these, because you should kind of know what the sympathetic does. You should know from experience. Chapter 15, autonomic plexus. Cardiac, pulmonary, esophageal, abdominal. Autonomic motor, visceral sensory organs arranged in the GI tract, innervates smooth muscle, coordinates paralysis, movement that pushes material through GI tract, includes two large plexuses. We don't need to know that slide though. So we're getting a quick overview again of the ANS neurotransmitters. The ANS uses acetylcholine. We've been through this. And non-epinephrine. We've been through this. Which one is the acetylcholine again? Right. It is the parasympathetic. Which one is non-epinephrine? Correct. It is the sympathetic. Either transmitter can be used in stimulation or inhibition, depending on the postsynaptic receptor. Cells that release ACT or acetylcholine are cholinergic neurons. Cholinergic neurons include all ANS, preganglion neurons. Keep in mind this is the shorter one in the sympathetic. Yes, sympathetic division. All parasympathetic ganglion neurons. Sympathetic ganglion neurons innervating sweat glands and blood vessels. So, it makes sense because all parasympathetic we know is ACT. It releases that. Meanwhile, sympathetic is norepinephrine. Target cells that have cholinergic receptors are nicotine and muscarinic. So just keep that in mind because this is what these are going to affect. Meanwhile, cells that release norepinephrine are adrenic neurons. Again, you kind of getting that adrenal in it. Adrenal, kind of similar, slightly. Trying to get the lighting a little better because I just look like a shadow in the dark. It was worth the risk. Breakup Shoes, absolute banger of a band. I recommend them. Most sympathetic ganglion neurons are adrenic. Again, sympathetic releases non-epinephrine, and that's what the adrenic neurons attach to. Use your brain. Target cells that have adrenic receptors. She's on the stunning. But there's definitely some. We'll figure it out as we go. Remember what cholinergic rejector receptors are? They are the acetylcholine that is parasympathetic. You're getting it now. I know you are. And cholinergic receptors have two main types that will accept them: nicotine and muscarinic. Nicotine receptors are found on all ganglion neurons and adrenal medulla cells. Also on the skeletal muscles of neuromuscular junctions. So nicotinic, just think of nicotine. Think of how you relax when you have it. I don't know. I've never actually tried nicotine. Fun fact about me. But I imagine you kind of get this like relaxed feeling, you know. When ACK binds to nicotine receptors, it opens a cation channel, meaning the positive cells are going to flood out. So going back a chapter, which one is our cation? Sodium or potassium? I want to say it's potassium. But Na rushes into the cell as K moves out of the cell at a slower rate, though. So depolarized excitatory postsynaptic potential produce. Subtypes of nicotine receptors. She doesn't list any, but she has that in the slide. Then you have the muscarinic receptors found in all target organs of parasympathetic division and a few of sympathetic. So purely nicotine is all parasympathetic and adrenal medulla. It's found on all ganglionic, neurons in adrenal medulla. So it's found like on everything. Meanwhile, the muscarinic are only found in the parasympathetic and a few sympathetic. Sympathetic factors would include sweat glands and blood vessels in skeletal muscle. Think about it. It's muscle is in the name. The only things that it just makes sense. When you're using your muscle, you sweat, blood vessels, and skeletal. I don't know. It just makes sense. Muscarinic receptors are not channels, use second messages. Different subtypes of receptors have different effects. So basically everyone is quirky in this one. When ACK binds to muscarinic receptors of smooth in the GI tract, it's stimulated to contract more. Think about what ACK does. Acetylcholine does in muscle contraction. It should just click. Binds to muscarinic receptors of the smooth muscles in GI tract. It is stimulated to contract more. When ACK binds to muscarinic receptors on cardiac muscle, the heart rate decreases. So it's mostly found in the parasympathetic, so we know that's rest and digest. So to me, it just makes sense that it kind of relaxes the body. Your heart rate decreases. Adrenal receptors. Again, you have that adrenaline kind of word in it. This is sympathetic. No epinephrine and epinephrine, both catecholamas that bind to adrenal receptors. The two main types of adrenal receptors are alpha and beta receptors. You know I'm going to be using it to my advantage to come with some mnemonics later on. Both of these receptors have subtypes, very important when developing medication to specifically target the correct receptor to limit side effects. So we're still talking about the adrenal receptors. We have alpha, A1 receptors, and A2 receptors. A1 is stimulatory receptors found on most smooth muscles, located in blood vessels, erector pillar. So you know your smooth muscles by now. I don't have to read through those. If you don't know what a smooth muscle is now, leave this class. Get out of here. Scram. But when you're in alpha, you're on top. You're number one in this case. You just sit and enjoy the ride. Smooth muscle. Smooth muscle is slow contractions. Meanwhile, you have A2 receptors located throughout the CNS and pancreas and the GI specters. Its constriction inhibits. So when you're number 2, you're a little bit of a jerk. You're not number 1, you're upset. You inhibit people from doing stuff. You constrict them from doing stuff. So that's, what it does. And then you got we're skipping this slide. I went through that for nothing. Autonomic tone. Most effectors are innervated by both divisions of ANS. Both continuously release neurotransmitters. Generate an autonomic tone. Most effectors are innervated by both divisions. So yes, that is true. Both continuously release neurotransmitter. That is also a true statement. They generate an autonomic tone. In some instances, only one division controls the status of an effector. For example, blood vessels usually impart partially constricted state due to sympathetic tone, called vasomotor tones. This is just kind of like you when your body's toned and you have like a nice little, like build, you're kind of always there. You know what I'm trying to say? Hopefully you do. Vessel constricts if sympathetic activity increases. Vessels dilate if sympathetic activity decreases. So it creates a tone. It sets the vibe of things, if that makes sense. Vagal tone continually decreases heart rate. Dual innervation. Organ receives input from both sympathetic and parasympathetic divisions. Two divisions may have antagonist or cooperative effects. So that's what I was trying to think about here when they were talking about motor effects are innervated by both the divisions of ANS. Both continuously release neurotransmitters. So, but this is the dual innervation. Two divisions may have antagonist or cooperative effects. Antagonists, commonly the two divisions oppose each other. This is the most common. If they ask a question about this, just know it's the most common. You're more likely to get it right. Parasympathetic activity slows heart rate. Sympathetic activity increases heart rate because parasympathetic is rest and digest. It's trying to save calories. Meanwhile, the parasympathetic activity increases GI. Sympathetic decreases mortality. Parasympathetic activity decreases pupil. Sympathetic activity increases pupil. The only cooperative effect that we need to know about is seen when the parasympathetic and sympathetic have different effects that are part of an overall response. For example, male sexual function. Symptoms controlled only by the sympathetic division. Opposing effects can be achieved without dual innervation. Blood vessels constrict with increased sympathetic activity. They dilate with decreased sympathetic activity. Examples of effectors innervated by only the sympathetic: sweat glands in the trach, erector. So then you have some that aren't dual innervated, and that's where this statement way above comes. That makes it isn't true, because it isn't innervated by both. Adrenal medulla, neurocrusida cells, erector pili, sweat glands. So then we're back to reflexes. Autonomic reflexes, visceral reflexes, are pre-programmed responses to stimulus by a reflex arc. Again, reflex arc is just the pattern it takes. An arc includes receptors, sensory relay to CNS, CNS integration center, motor neuron effector. So that should just make sense. You receive the signal, you relay the signal, you integrate the signal, you have to communicate to the effector somehow, so you motor the signal. I don't know how to put that into words, but you have to receive it. And then the ANS effectors are cardiac smooth muscles or glands. So this is what we're talking about right now with the autonomic. Blood pressure, defecation, urination are all part of this like reflex. Though it will say once toilet train signals through the pons allow for voluntary control of the external urethral spinacle. So you won't piss or shit yourself anymore, basically, is what that's saying. But visceral reflex arc have two neurons in the motor pathway. So basically, this is what in my brain, so having taken anatomy, this is what we learned about in high school, this autonomic. It's just sensory on top of motor, and that's it. But when you go to somatic, it's going to be motor, possibly an interneuron, sensory, possibly an interneuron, motor, and then sensory, definitely an interneuron, motor. So like it takes like two, you're doing two actions with this one. This one is just one action. Development aspects of the ANS. Effects because of age is constipation, dry eyes, frequent eye infections, orthostatic hypotension. So what do you expect in old people? This is not shocking. And that, my friends, is chapter 15. Done.